Our next question. With more than 200,000 seniors living in the 16th Congressional District, Medicare reform is a major concern. Most of the debate from the Republican and Democratic parties focuses on demonizing their opponents' approaches and thus scaring citizens with little discussion of real solutions. How can this health care program remain solvent for upcoming generations, and what are your solutions? I believe it's Mr. Fitzgerald.
Thanks, and I agree with you. There's been a lot of demonization here. One of the craziest things that's going on right now is my opponent has an ad up acting like I'm an incumbent and I'm responsible for a plan that's out there. He says that I would support rating Medicare for $716 billion. Let me be clear about something. There's only one person sitting up here who ever voted to take $716 billion out of Medicare, and that was Representative Buchanan, who voted for it twice in the Ryan Amendment. But you know what? I don't criticize him for that, because those were actually $716 billion of overpayments to insurance industry people. So there has been a lot of demonization. But let's get this straight. We do not need to voucherize Medicare to fix it. That's what Representative Buchanan advocates. I think that's just dead wrong. The reason is it doesn't address the primary problem, which is cost control. In order to fix Medicare, we have to fix the whole medical care system. I want to have doctors and healthcare providers in charge of new ways of getting cost control in healthcare. That should include things like service provider payment reform programs. And there are various different ways to do that. Something I worked on in the state legislature in a bipartisan way was patient-centered medical homes. That is a way of coordinating healthcare that brings down costs but actually improves outcomes. We need to move in these directions if we're going to fix this problem. We need accountable care organizations. We need to look at evidence-based rates for payment. The key to Medicare reform is the key to health care reform. Lowering costs while improving outcomes. All the partisan bickering about this is not addressing the fundamental issue. So let's get serious. It's a little wonky, but get away from the gimmicks like voucherizing Medicare, and let's really address what the source of the problem is, which is cost containment.
Mr. Buchanan.
Now, I think one thing I would think Keith would agree to as the representative is the idea that it is going insolvent, whether it's a matter of 8 or 12 years. I hear 2024. I heard the other day in a debate, I think a senator or something said it could go insolvent in a matter of 3 years if they didn't put the other program in place. But it does cut $716 billion out of the Medicare to pay for Obamacare. Basically, that's what's happened from that standpoint. I mean, you can look at it, that's what everybody says. And really zero in on what we're talking about here. What it impacts us here in this region, it's $2.2 billion, $800 million in Manatee County. That's the cuts. That will hit hospitals, doctors, nurses. I'll be glad to give you the University of Minnesota did the study, a nonpartisan group. So it is gigantic to our state, to our region. And yeah, we, in the Ryan budget, and let me just say that what the Ryan budget does, it doesn't affect anybody 55 and older. So Medicare, for them, everything stays the same. Under 55, you can either take traditional Medicare or you can take an option like a federal employee or something else. So it gives you some choices. So that's the difference. But my big concern is it cuts $716 billion. Those are real cuts. When you look at it as it relates to our area, it's $2.2 billion, Sarasota, Manatee County, and it's going to have a huge impact on affecting a lot of jobs and opportunities in this area. The other thing I just want to say in terms of Obamacare, people are very concerned. I went to an employee the other day, and I was actually just going in to buy something, and he said, "Vern, can I talk to you for a minute?" I said, "Sure." He said, "I've got 70 employees. I'm going to have to cut down to 50 employees because of what Obamacare is going to do to my business. I cannot afford what they're talking about for 50 employees over in terms of paying for medical insurance." So there's a lot of people that are concerned about this. Health care in general is a whole other discussion. I hope we take a few minutes and talk about health care for businesses and employees and stuff in the area as well.
Well, yeah, and I have to tell you, I'm a little bit shocked that a member of the Ways and Means Committee doesn't understand the most basic things about these issues. Let's go back to that $716 billion. A bipartisan commission said that there were overpayments of about, at that time they said $500 billion. They've upped the ante to $716 billion. Bipartisan commission. The Obama plan for health care said, let's stop those overpayments to insurance companies. By the way, Romney says, let's do it. He voted for the exact same thing 2 times. Right now, not for 55, right now, he voted to take that $716 billion. But it doesn't come out of the trust fund. It reduces the obligations from the trust fund. Yes, the Obama administration expanded Medicare benefits with some of that $716 billion. Representative Buchanan's plan was to actually take that and use it for tax cuts for the wealthiest people. He should really understand what he's voting for when he votes for it, because he voted for that $716 billion cut 2 different times.
In terms of the cut, it goes back into the solvency of Medicare. That's what their cuts are very real. Obamacare raids Medicare and goes into Obamacare to pay for it. And those cuts, it's 200. Those cuts locally are $2.2 billion, $800 million in this county, and we can't afford it.